right. Good morning, everyone. Thank you for joining us on this Saturday morning. I know the weather is starting to improve, so you resisted the urge to enjoy the slightly warmer weather. It's my great pleasure today to host or co-host a session by the Cancer Research Advocacy Group and the Cancer Center at Illinois. We're going to talk about navigating treatment and survivorship, support networks, and the healing process. This is really exciting. This is the third event that our Cancer Research Advocacy Group has hosted for the public. The first one was pre-pandemic, where we hosted one specifically for cancer research advocacy. And then just post-pandemic, about a year and a half ago, we hosted an in-person event talking about various survivorship strategies. And this time we're hosting virtually for a couple of reasons. Hopefully on a Saturday morning, you didn't have to get out of your warm, snuggly pajamas. And we hope to record this session and post it on our website as an ongoing resource for anyone who is suffering from cancer, thriving with cancer, or caregivers, etc. So with that, I'll introduce myself. My name is Eric Nelson. I'm an associate professor at the University of Illinois here in Urbana-Champaign, and Craig is co-led by, let her introduce herself.
Hi, I'm Susan Leggett, of course, co-leader and a faculty member, assistant professor at the University of Illinois. And so we'll start off today, as Eric had mentioned, this is a new seminar series, so it's our first seminar series. And so with that, we'd like to introduce to you what the Cancer Research Advocacy Group is at the Cancer Center at Illinois. So what we do, who we are, and then we will have one of our lovely CREG members talk to you about how to best strategies for working with the insurance system with knowledge and patience, which can certainly be a challenging thing to do during those times. Then we'll have a roundtable with multiple CREG members for tips to overcoming survivorship stressors and pressures, and then finally closing remarks. And so we will moderate the chat, so please ask questions throughout the session, and when it's appropriate, we will answer those, or we'll prompt members to answer those. And next.
All right. So the origins of the group started in 2015, 2016. Myself and another faculty member at the time, we had just started at the University of Illinois, and we were doing cancer-based research. And while we had a really strong grasp of how to do studies in the test tube, and we had a reasonable knowledge of clinical shortfalls because we interact a lot with clinicians, we really didn't have a perspective from the patients. We didn't know really what they were going through or what hurdles were in their way, despite the clinical care that was being offered to them. And as researchers, those are the questions that we wanted to address. So we formed the Cancer Research Advocacy Group, which is a collective of survivors, caregivers, clinicians, and of course, researchers. And the goal was to get everyone into the same room, talking the same language, and highlighting all the things that patients see as barriers to their treatment or long-term survivorship.
Great, thanks, Eric. And so part of a big component of what we do can be conveyed through our mission. And so really we care about patient-centered perspectives, both from the research side to inform those perspectives, or their perspectives to inform our research, and specifically to do this to both enhance outcomes as well as experiences for patients, survivors, caregivers, and really doing that by bridging, as Eric had mentioned, those gaps with researchers, clinicians, and the cancer community. And so, as mentioned, caring about patient perspectives is really critical. And as CREG members, the way in which we can address this is by working together. So this really is a collaboration between the researchers and our CREG members, and hopefully at the community, which is where this survivorship series is beginning with. And so for researchers, we listen to the patient perspective to inform what experiments we do. And as advocates, in addition to giving us that information, can lobby for cancer research funding, which is necessary to make our research possible. And then together, as an example of what we're doing today, is to better establish tools to aid in patient education, support, and further that communication across broader settings. And so finally, how we do this is through actually meeting monthly. And so this seminar series has been a big effort in progress, and we hope to continue this as a monthly series. And so we're always discussing these critical needs for research and patient care. Specifically, how can we best together address these challenges by engaging with the community as a whole?
And that will prompt you later on through today too. But if you would like to join our advocacy group, please send an email to Susan and myself, and we'll have all that information at the end of today's session. Right now, we're just going to play a short video of who we are and what we do.
Cancer survivors understand the experience best. The moment of diagnosis, treatment, and living in the aftermath. Their perspective can play a critical role in the fight against this disease. That's where the Cancer Research Advocacy Group comes in. The Cancer Research Advocacy Group, or CRAG, is an extension of the Cancer Center at Illinois, a research institute at the University of Illinois Urbana-Champaign. CRAG's mission is to bridge the gap between patient and scientist, connecting survivors with cancer researchers and clinicians to positively impact patient experiences and outcomes. Since 2015, CRAG members have helped shape how Cancer Center scientists think about their projects, and they've given valuable advice to medical personnel and advocates. Catherine Applegate is a longtime member of the group, a cancer researcher and a cancer survivor.
The reason why it's so important for cancer researchers and patients to talk to each other is so that researchers can get a sense of what the personal experiences are of these patients, what types of side effects they're dealing with, for example, what types of adverse effects after the fact. So after cancer treatment, whether they're suffering from mental health effects, cognitive effects, you can incorporate those experiences into finding better alternative therapies or creating drugs that have less of those really awful side effects that really bother people.
The Cancer Research Advocacy Group, bringing the human perspective to research, one conversation at a time.